What are some of the efforts that AAPM&R is moving forward with in order to help overcome these workforce challenges?
That is a great question, and it's a big challenge. I will say that the Academy has advocated, along with others, to expand PM&R residencies, and in fact, that has happened. So there'll be more folks who will be eligible to be board certified in physical medicine and rehabilitation. We've also put a lot of energy and effort to define and defend the role of physiatrists in inpatient rehabilitation facilities, as well as subacute rehabs or skilled nursing facilities, trying to limit the encroachment or stop the encroachment of other specialties into our specialty. No one has our training in leading a multidisciplinary team. So we really are vital in those roles. So we're working diligently to prevent that encroachment in our scope of practice. Really important. And I think we also have to recognize, though, that even if we do all of that, what I just mentioned, just simply isn't enough. We are the specialty of disability, and if we are to meet the needs of people with disability in this country, we need to do even more than expand residencies and prevent this encroachment. One of the things that we can do, we're trying to do, is to appropriately use advanced practice providers, those are nurse practitioners and physician's assistants, but use them appropriately. I'm going to start off by saying that the Academy vigorously opposes the independent practice of advanced practice providers as independent practitioners in PM&R. We do, however, strongly support that they can be part and should be part of a team of rehabilitation professionals that are led by a physiatrist. And in that capacity, we can expand our reach to ensure that we can do better in meeting the needs of people with disability across the country. To that end, I will say that the Academy is developing educational courses to ensure that physiatrists know how to use APPs appropriately, and to ensure that they know that our position is that APPs need to be part of a rehabilitation team and not be independent practitioners. We also recognize that many physiatrists already have APPs, so we want to make sure that they're using them appropriately. And I think we all recognize that physical medicine and rehabilitation is such a unique specialty. There are other, physicians who, quite frankly, don't know what we do. That's part of what we're doing with our awareness initiatives. So we also want to be able to train APPs to be effective members of that PM&R team that is led by a physiatrist. This will help us really expand our reach. So instead of, for example, myself having, I'll just make it up, 1,000 patients with the use of appropriate APPs, I can double or triple that, being able to fully reach the folks who really need our care. These are just some of the things that we're doing to ensure that we achieve our bold vision and provide the care that people with disabilities need. And, there's no one better at doing that than physiatrists. We have the secret sauce that no other specialty does. So those are some of the things that we're doing, and I'm looking forward to continuing that work with the Academy to ensure that that happens.
Thank you so much for these
Mhm.
valuable insights, and appreciate the use of the secret sauce.